Hello, my name is Miranda Avila, and I am in the medical assisting program. And right now we are on Module G, which is the microbiology and patient preparation. And I will be presenting the patient positioning PowerPoint. The sitting position consists of a patient who sits at the edge of an examining table without back support and with their feet over the edge. When they're in this position, the patient examines the patient's head, neck, chest, heart, back, and arms, and they are draped. They are draped because they are needed to be draped from the lower waist. The lower waist on the lap for men and across the patient's chest and lap for women. The sitting position procedures supplies consist of, for example, a physical examination. So that would consist of an otoscope, an examination, and a light, a laryngeal mirror, a nasal spectrum, an otoscope, an ophthalmoscope, a pen light, percussion hammer, siphomometer, a stethoscope, a thermometer, and a turning fork. The supine position is in the supinourectomy position, and the patient lies flat on the back with their hands to the side or on the abdomen, and a physician can examine the head, neck, chest, heart, abdomen, arms, and leg when a patient is in this position. The patient is normally draped from the neck or underarms down to the feet. The supine position may not be comfortable for patients who become short of breath easily or for a pregnancy patient in her late pregnancy. You can make these patients more comfortable by placing pillows under their head and knees. Supine position procedure instruments. A procedure that can be done in the supine position would be an abdominal procedure, and it can be done in a person's abdominal in a supine position to diagnose or treat a medical condition. The instruments that can be used in the abdominal procedure can be the Mayo scissors, Spencer Wells, swaddle scissors, little wood forceps. The dorsal recumbent position has a patient lie face up with the back supporting all the weight. This position is the same as the supine position, except the patient's knees are drawn up and the feet are flat on the table. The hands can be at the patient's side or on the abdomen. The physician may examine the head, neck, chest, and heart while a patient is in this position. The patient is normally draped from the neck or underarms down to the feet. A dorsal recumbent procedure supplies consists, for example, a procedure that can be done can be a genital examination in the dorsal recumbent position. The doctor will check the size and shape of your uterus and ovaries, and make sure nothing tender around the area or unusual growths. Some instruments that can be used during this procedure can be the sponge forceps, Bozeman Douglas, Cypheroid tracheum forceps, uterine sound, a grave speculum, and a gaff spot. The lithotomy position is used during the examination of a female genitalia. In this position, the patient lies on her back with her knees bent and her feet stirrup attached to the end of the examining table. You may need to help the patient place her feet on the stirrups. She should then slide forward to position her buttocks near the edge of the table. Lithotomy procedure supplies that can be used during the lithotomy position. For example, a procedure that can be done would be the IUD. And the IUD procedure can be done on a woman in the lithotomy position. And an IUD is a small T-shaped device that is placed inside the uterus to prevent pregnancy. The IUD supplies consist of the IUD and package contents, a speculum, lubricant, a single tooth tenaculum, a uterine sound, antiseptic solution, sterile gloves, and scissors. In a Fowler's position, the patient lies on an examining table on which the head is elevated at 45-degree angle. The physician may examine the patient's head, neck, and chest areas while they're in this position. The patient is usually draped from the neck or underarms down to the feet. Fowler's position is one of the best positions for examining patients who are experiencing shortness of breath or patients with a lower back injury. Fowler's procedure supplies. Another procedure that can be done in a Fowler's position can be the shoulder surgery, shoulder surgery, and it can be done by using rotator cuff, graspers, basket punches, and soft tissue elevators. Prone position. The prone position, the patient is lying flat on the table face down. The patient's head is turned to one side and the arms are placed at the sides or bent at the elbows. And the patient is normally draped from back to feet. In the prone position, a procedure and the supplies that can be used, a procedure can be back surgery, and this can be done in the prone position. And the back surgery is a procedure that aims to change a patient's anatomy, such as removing a herniated disc that is causing pain. And the back surgery procedures that can be used can be careters, elevators, retractors, chisels, suction tubes, and mallets and taps. In the Sims position, the patient lies on the left side, and the patient's left leg is slightly bent, and the left arm is placed behind the back. So the patient's weight is resting primarily on the chest, and her right knee is bent and raised towards the chest, and the right arm is bent toward the head for support. The procedures or positions that can be used in the Sims position, prosectomy, rigid sigmoidoscopy can be done in the Sims position, and it is a procedure to examine the inside of the rectum and the anus. The supplies for this procedure include a scope, stylet, obturator, eyepiece, bellows, light source, air filters, water-based lubricant, and PPE, which is a face shield, gloves, and a gown to make sure that you don't have any patient specimens on you, and just to prevent any microorganisms from spreading. The knee to elbow position, the patient is lying on the table face down, supporting the body with the knees and chest. The patient's thighs should be at a 90-degree angle to the table and slightly separated. The patient's head is turned to one side and the arms are placed to the side or above the head. The patient may need your assistance to assume this position correctly and maintain it during the exam. A procedure and supplies that can be done and used in the knee to elbow can be a colonoscopy. And a colonoscopy is is an examen used to detect changes or abnormalities in the large intestine, which is the colon and rectum. The procedures that are required for a colonoscopy is a flexible instrument which is very long and includes a camera ability to remove tissue. A proctologic position can be used as an alternative for a Sims or knee to chest position. But in the proctologic position, the patient is bent at the hips at a 90-degree angle, and the patient can assume this position by standing next to the examining table that is available. And the patient can assume this position by lying prone on the table, which is then raised in the middle with both ends pointing down. The procedures and supplies that can be done in a proctologic position can be an enema procedure, and that procedure is in which liquid or gas is injected into the rectum. And the supplies that are required for this procedure include gloves and disposable apron, inconsistent pads, lubricating solution, jug with water warmed to desired procedure, water thermometer, bedpan commode, and prepared solution. And that is it. Thank you so much for watching.